Be empowered. Be strong. Take charge. Speak life. Live life abundantly. Get with it now. You are now entering the chat room. Health Chat with Coach Jean, that is, where we debate, debunk, educate, empower, impart, and raise awareness on all things related to health, healing, and holistic well-being, body, mind, and spirit. Let's go.
Hey, what is going on, everybody? Lottie-dottie, everybody. Hey, this is your girl, Coach Jean Turner, and I thank God for the opportunity to be back in the chat room for another episode of Health Chat with Coach Jean, where we debate, debunk, educate, empower, and bring awareness to all things related to health, healing, and holistic well-being, body, mind, and spirit. Yes. And so you know how we do here in the chat room. Go ahead, and if you are on Facebook or Instagram, go to my pages, Health Chat with Coach Jean. And, if you are on LinkedIn, I'm under Nurse Coach Jean. But go ahead and put your comments and questions for tonight's show under the promo for this episode. And so, look, did you know it was National Hand Washing Awareness Week? And I hope that I know what I do in my household when I'm out, but I hope that all of you are conducting great, not just great, but outstanding hand washing hygiene, okay? Look, we're still in the midst of a pandemic that does not seem to be it's not letting go of steam. It is moving full steam ahead, and outstanding hand washing hygiene is more important now than ever before. So please make sure you are washing your hands for at least 20 seconds, okay? At least 20 seconds with warm soap and water. And if you are not where you have soap and water available, then I'm going to need you to make sure you are carrying that hand sanitizer with you and make sure it is greater than 65. Let me say this, greater than at least 60% alcohol, preferably 70% or greater alcohol content in it. And so there's more I could say on that, but I'm not going to prolong the time. But please, take care of yourself. Let's take care of each other. Stop going around. I got to say this one. Look, too many of us going around talking about we love one another. Oh, I love you with the love of Christ, but you ain't even wearing a mask, yo. Okay? I'm going to need y'all to kill that noise, all right? You love me. You love your fellow mankind with the love of Christ. God is love, right? You love God whom you don't see, but look. If we truly love one another, then we going to be wearing these masks over our nose and our mouths. And I'm going to leave that right there. Any questions? Y'all know how to locate your girl, all right? Or hit me up on my social media pages or email me. Y'all know how to find me. But listen, I want to give a personal shout out to Miss Marie Edwards of ECV Talks for the post on her social media platforms, encouraging her followers to tune in to Health Chat with your girl, Coach Jean. So thank you, Marie, for the shout out and for tuning in to Health Chat on this evening. And so we thank and praise God for another opportunity, to be on this platform. Health Chat with Coach Jean is a worldwide syndicated podcast on several major platforms, including Pray.com. So you can always go back and binge listen to every episode of Health Chat with Coach Jean on Pray.com, Spreaker, where we are currently live streaming from, Spotify, Apple Podcasts, and iHeart. And look, the cool thing about podcasting, is that you can keep up with your self-care, get your self-care information and your weekly Coach Jean health tips wherever and whenever, right? You can take health chat on the go. So, hey, have at it. So, I have a little rhyme I was going to share with y'all, but I ain't going to go there, On the go, yo. On the go, yo. And y'all know I like to be silly sometimes, and I like to have fun. So, hey, anywho, you all know how we do here in the chat room. But, hey, it's time to get to the night's topic. So let's pray and get it popping. Most gracious Heavenly Father, in the mighty name of your Son, Jesus Christ, we thank you for yet another opportunity to be here in the chat room, ministering to your people all over the world. We do not take it lightly, and we do not take it for granted. So we thank you right now for allowing us this platform to bring awareness to all things related to health, healing, and holistic well-being. Thank you for our producer. Thank you for the listeners. Thank you for my guests. And I pray that on tonight, something shared will bless the listener and those who will catch the replay. And it's in your precious Son, Jesus' name, that I do pray. Amen. Amen and amen. And so my guest joining me here tonight in the chat room is a speaker, coach, entrepreneur, author, collaborator, and the owner of PRN Home Care. She has over 30 years in the healthcare profession. She holds a degree in occupational therapy. She is also the co-founder and director of the internationally known Success Women's Conference and the visionary and author for an upcoming book anthology, which your girl, Coach Jean, is a part of it. I'm so happy to be a part of it. But it is titled Make It Happen. Yes, make it happen, yo. And so my guest is the one and the only Miss Kearn Cherry. Patty, Miss Kearn, are you in the virtual building?
I am. I'm actually online. I'm sorry. I am actually online talking to you. I'm not sure what a virtual building is, but anyway, how are you doing?
I'm good. That's what I call podcast land and internet radio, the virtual building. You know how radio normally was or was it sometime, and we have to go right on into the studio. So that's what I call the virtual building.
Okay. I was like, oh, my goodness, I don't miss something else. Hello, everybody. I am so thrilled to be here and to be able to share with your audience, especially our girl, Coach Jean Turner. I'm so thrilled that she invited me on her show and to be a part of it. So thank you.
Oh, you are so welcome. I've been looking forward to this chat all week long, and I know you're a very busy woman, so I appreciate you. And so, if you will, I know now, let me just say this. You and I have this in common. We've both been in the healthcare profession for over 3 decades. I've been, March will be 34 years for me. And so, share what you will with us here in the chat room this evening, your background in healthcare and the work that you do in home health with caregivers, especially caregivers, but the population you serve, because I'm assuming a lot of them are our senior population.
Right. So I basically started off in healthcare like you said, many moons ago. It doesn't seem like that long, but right while I was in college, I was actually working at a military base in a OBGYN clinic, and so I have spent most of my life working in some part of healthcare. My background is in occupational therapy. My husband and I both finished while we were in Arizona and moved back here to Biloxi, Mississippi. We were planning to, keep traveling to Florida, but we stopped in Mississippi to visit, and of course, we've been here ever since. We actually started our home care business in 1997, and we've been running it ever since. We actually serve. So for us, we started being that we were in rehab and mostly working with the seniors in the nursing home. You know, we found that you could just serve people better in their home. You know, you can provide better service in their home. And so back in those times, somewhere around 99 or so, the whole nation was pink slipped as far as the fields, occupational therapy, physical therapy, speech therapists. And so we decided, you know, let's take care of people, help people stay in their home, right? Because a lot of seniors, they really want to be in their home if they can. And if they're not in their home, like assisted living, personal care homes, and even the nursing homes, we still have people that serve them there as well. Now, we're not able to do that in COVID time, but
right.
That's what we've been doing for the last 20-something years. We also even had an adult daycare center at one time that we ran for a couple of years. So we found that people just really wanted to stay at home. They really didn't want to be in a facility. Most of our clients, they really wanted to be in their home situation. So that's kind of where I'm at. We actually serve a lot of. We do. Most of our clients are senior citizens. Occasionally we have some people, you know, disabled, paralyzed, or something like that. We serve a lot of veterans. We've been serving the veterans across the Gulf Coast, even used to serve them in Alabama too. We've had veterans over there as well that need service, because a lot of the veterans may not realize that the VA do have services where they pay for what they call non-medical care. And that being said, we provide things like things that people take for granted, but as you get older, it's not something that you can take for granted anymore, like cleaning, like running errands. As you get older, people don't drive as well, so we have people that take them to the store. Sometimes they go to the store for them. They take them to doctor's appointments. We have many who adult children are checking on them, but they can't be with them 24/7. So that's when our services comes in and allows that person who's still able to be home but need that person there helping them with daily routine things. And so we've had anywhere from nurse aides, bath aides, homemakers, errand runners, and occasionally we have some clients that just at a different level need a nurse that comes in with them as well.
Right. And so another thing we have in common, Kearn, look, my background, I am nationally certified as an inpatient OB nurse, but since retiring from the Army, I really don't use it unless to do some education now. But yeah, I have an OB background.
Okay, yes. Oh my goodness. Then you've seen a lot, because when I was working at Keesler Military, you see a lot. For Keesler, they serve all the armed Air Force people, all the armed forces, from the Navy to the Army. All those people eventually, if their husbands are here locally in Biloxi, they have access to Keesler. And so, of course, this was back in the day for me when I worked out there. But, yeah, those were, fun days to remember. But you see a lot when you're working in an OBGYN clinic.
Oh, yeah, and even more when you in that labor and delivery room, let me tell you. Yes, Lord, I'm having an 8-track flashback right now. But anyway, let me stay focused, because, yeah, I'm really having a flashback right now. But listen, I was recently, and I don't watch news that often because I can't take the tomfoolery right now going on within our nation. But I was listening one night to a recent interview on CNN where they interviewed, I think it was the governor of Connecticut, Ned Lamont, and he had actually made a statement that, and I'm paraphrasing it, but that he believes that as a result of this pandemic, that, more and more people are going to be turning to home health as opposed to their elderly parents or grandparents or loved ones going to the long-term care facilities, particularly the nursing homes. What's your thoughts on that? And are you seeing more people turn to home health now because of the pandemic or not? What are your thoughts?
Well, and I was going to speak to that because, again, my husband and I are both in the field, and we often talk about some of the things that are going on in healthcare. First of all, it's normally slow this time of the year for most people in the home care business and even assisted living, but it's actually been busier for us this time of the year, which, is a blessing, that's for sure. And so, right. But I do believe because the problem that I'm seeing is that we don't have access to our loved ones. And from your background that when people are locked up, because in a nursing home, you're already alone, right? Or right. Even in assisted living and all the other facilities, when you start telling people you can't come in to see them, or you can only see them once a month, or holidays or something like that, that kind of makes the family rethink, well, am I going to really want to put my mother, my dad, or whoever in a facility? I literally my husband and I literally discussed this and said, I think people are going to start bringing their people out of some of these facilities if they don't get some kind of control here soon. And I think some of them are just not going to put their people in a facility because right now the biggest outbreaks do happen in some of the facilities. So, yeah. And now you have this thing, well, do you really want your loved one to take the new shot that's coming out? Because it's still in test mode, right? And right. So you're going to have to make that decision. And so I think a lot of people are thinking, well, if they're home with me, and it's just, my husband and I, we've been had the empty nest syndrome, right? So if they're home with me, it's just us. We don't go out as much. Maybe they'll be just safer here. I think people are going to start thinking like that. And there are already people that have done that in the past, but more so now when they're making the choice during COVID, which you and I and most of us are starting to realize that COVID is going to go well into 2021.
Oh, yeah. Oh, yeah. And look. That's a whole nother discussion about that vaccine and taking that vaccine. And me and my husband were talking about that, and I was like, unless the good Lord tell me himself, I am not. I already put it out there. I'm not going to be nobody's guinea pig. I'm going to have to see some data 6 months, a year from now about some possible side effects or something. You know what I'm saying? No, I ain't playing. No.
Exactly.
Yeah. Exactly.
Yeah. I agree with you because, basically there's no proof that this stuff is really working. And so, and then what's the consequences down the road? That's what people are going to want to ask. And so, and then you got all the people in the healthcare. They just assume that all the people that are working in healthcare are going to just comply and take this shot. That has not been truly tested. You know, I'm like, no. I mean, secondly, is this the same grade of vaccine that the president got? How do we know that? Hello? We know that in any industry, you know, the organization creating it is going to find ways to cut corners. You know what I'm saying? And who's going to be the guinea pig on that? So, yeah, I think a lot of people are going to think twice before taking it, just like all these other vaccines that they went around the world giving people, what was Ebola and some of the other ones and stuff like that. You know, what were the consequences to that? We don't never hear the real data on that. We have to take your word for that, and let's face it, you can't believe everything you're hearing, right?
That's
so,
right. That's right.
Yeah, and they're getting pushback on the mask as it is. So you know we have certain people in the country that already are saying they're not gonna be compliant. So I don't know. You don't know. You don't know who to believe, what to believe, and I'm like you. I'm gonna rely on God to get me some guidance.
Come on, you better have some discernment. You better, you better know that you know in these times, let me tell you. And so, you know, when we talk about, you know, because this is not an easy topic for a lot of folks. I remember when my mother, rest in peace right now, but when Mommy was still living, there was a period of about 3 years to where she came to live with me and my husband, and our kids were still home at the time. This was like the late 90s. And I became her caregiver, which meant that I had to go from full-time, actually I had like 2 different gigs going on at the same time. But I had to really work around my hours, right, and decrease the amount of times that I was actually at work in the office and work more hours from home so that I could be there to take care of her. And so these are just some of some of the things that caregivers have to think about, and especially when they have, that sandwich generation, to where they're sandwiched between taking care of their elderly parents or grandparents and raising kids.
Exactly. And then, so you actually have a lot more young people now that are helping take care of the senior now. That puts us at a bigger situation, right? Because before COVID, pre-COVID, there were already young teenagers that assisted their parents in keeping their parents home. But we all know with COVID, a lot of times the young people are the ones bringing COVID to the house. So you know what I'm saying? So there's a lot of things that has to be looked at with this COVID, how people are going to adjust. The people in the sandwich situation are dealing with now. They have children that are home when they're normally at school, and so they don't have to pay anybody to take care of them. And now you got these others where you don't want your teenage child being around your elderly parent, exposing them to COVID. It's just, we're in a crazy time as far as healthcare. The challenge is making the right decision and being able to keep that person at home as well. But I think, to be honest, most people are going to see that risk is a better risk to take than to have their family in some of the facilities. And I'm not saying the facilities are really not at fault as far as, they're at least some of the ones I know, they're doing the best they can with it. But once that COVID hits that facility, it's like wildfire. It just spreads. It just spreads massively and very quickly.
It spreads like wildfire.
And the staff is just as at risk as the rest of the people, as much as the seniors. I've had nurses died before even a client died. You know, it's really a sad situation. I'm not sure how we're going to get through it, but I know with God we will find a way.
We will find a way. And you know, the isolation alone, and my husband and I, our family experienced this firsthand last month, and a lot of people don't know about this. I guess more people will know about it now because I'm saying it on this podcast. But just last month, we experienced, you know, how a lot of these families may be feeling who have, you know, their elderly loved ones in nursing homes or assisted living, because when our oldest son is still serving in the Army, and he was involved in a helicopter crash last month. And when he finally arrived back here in the States, we could only see, first of all, we had to get permission to see him. And then they allowed us, we had to get on orders, and they allowed us to see him one at a time. And it was just his wife, our daughter-in-law, me and my husband, and we could only see him one person in the room at a time. And then, since then, they transferred him to a inpatient post-trauma rehab center where no one could see him, not even his wife. No one is allowed to see him. And the first thing, Kearn, I felt, and I was angry and I was crying in front of the medical teams. I was like, but he's going to be there all by himself, like in Virginia. Ain't nobody in Virginia, like, you know what I'm saying? So I could only, I experienced firsthand what a lot of these families are feeling, and it don't feel good. And then the patient, our senior family member, that I can't even imagine them, and even those who still are at home, living at home alone, how they are feeling.
Exactly. So, right, unfortunately, I've had to see both as well. My mom had COVID as well, but I'm going to tell you what I saw, and I want people to make sure they pay attention. What's happening with COVID, especially in the seniors, you have to be very, and I don't know if people realize there's a thing called COVID pneumonia, right? So
right.
I'm sure you probably know how flu, when people get the flu, they get pneumonia, and pneumonia is what actually really takes some people out. And so when they first diagnosed that COVID, I have been seeing that the COVID almost is the easy thing to treat if you don't get the underlying stuff under control, like the pneumonia, which we all know people drown in their sleep all the time from the fluid in their lungs, from pneumonia. And then with my mom, what was masking is she had a massive UTI that had moved to her bloodstream. She had at least 3 to 4, yes, ma'am, 3 to 4 bacteria in her bloodstream. Okay?
Wow.
And then, and so some people are surviving this and some people are not. Because when I talked to the nurse on the floor, she said, well, she's looking good now because she couldn't go to the hospital. And, of course, if they get COVID, you can't even come on the floor, right? Mm-hmm. And so so I finally got them to get the phone and do a FaceTime. And they were like, okay, well, she looks better. She did look better after they gave her the steroid shot. And that's what they initially do with COVID. They give them the steroid shot. Now, if y'all were paying attention recently, Nick Saban had COVID. Nick Saban, the coach of Alabama University football team. And so what they gave him was blood plasma.
Right.
And so, yeah. And see, my mom's a Jehovah's Witness, so she doesn't take any parts of the blood. But this is something I was surprised about, but they said this is what they're using. If a person has COVID, they try to get them to donate blood and take their blood plasma and give it to people to help them recover from COVID quicker.
Right.
And I'm like, I never heard of it before, but I guess they said that is a treatment method. Now, again, my mom recovered pretty quick on the COVID side because of the steroids. She bounced back. And so she could be one of the people that, you know, as they say, asymptomatic, where you won't know that she had, because she really did bounce back from that part real quick. It was really the UTI, urinary tract infection, that was almost taking her out again.
Right.
That being said, yeah, go ahead.
I'm sorry. I know. I was just going to say that it's those infections like that, like the UTI, that develop into sepsis, and that's what really affecting a lot of our senior population.
Yes, and that's what people need to. So if I was to tell a person caring for their seniors what they need to do right now, you need to be vigilant on making sure, of course, you hydrate them. Don't overhydrate them, but hydrate them. So make sure they're getting water. Make sure if they're starting to act a little confused, act on it right away, because if you combine that with COVID, it could take them out. So you want to go ahead and do that, because urinary tract infections cause you to act confused. It confuses their mind. And so that's always a sign for me when I'm like, okay, she obviously has UTI. Now, the other thing is, for the people with Alzheimer's, they already can't speak up for themselves. So you're going to have to be very vigilant on making sure that their electrolytes are in order. Because, like I said, they can't speak for themselves. They don't necessarily know when they're not feeling good, that they do not have a UTI. So they, you know, it may seem a little crazy, but you may have to do a little more to have them checked. If you feel like something's going on, you may have to go ahead and have a home health company come into your home, that the ones that have the nurses, you know, that Medicare pays for. So you may have to ask for that from your doctor. But be vigilant on their care. You know, diabetes and all that. Stay on top of making sure that sugar is controlled and things like that. So don't just focus on overexposing them to other people. Make sure that you're watching some of the health things, so that if they do get exposed, because what I've heard many times during this process with COVID is people keep saying, at some point, everybody's going to get it. At some point, you will get it. Well, if that's the case, we need to make sure our health is in check. And I wanted to say, a good friend of mine called me one day last month, and she's actually a nurse. And you check in on your friends every now and then to see how they're doing. Well, when she called in November, she said she had been in the hospital since August.
Oh!
Yeah.
A long time.
That's a long time, and you already know so she had a trach-in, and because of the situation with the hospitals and nursing homes now, she was not able to stay here to get to go into rehab. She had already spent many months in a specialty hospital, so they had to transfer her to a nursing home, not in her town, about a couple of hours from here, because nobody here could take the trach. And so, and then from all that, being out for 30 days in ICU and all of that, she had to learn to walk again, talk, all those things and she's in her early 60s. Like, y'all, this can happen to anybody. I think I asked her, I said, were you going out or, and I knew she wasn't the kind of person that went anywhere. And she said, I was taking care of my my grandchildren, so that they wouldn't have to go out, right? so they were not going. They were actually schooling online. So wasn't anybody really leaving the house except for her daughter and her son-in-law. And so the question was, where did it come from? No idea. No idea at all. And so that being said, it's in the air. I don't know. But whatever it is, we have to be prepared. And so what I'm challenging people is take care of yourself. Stay on top of things. I don't want to say be paranoid about it, but just, watch for yourself to make sure that you don't find yourself sitting in the ICU waking up 30 days later trying to figure out what's going on. And in her case, she wasn't even having any health issues, right?
Right.
But she had cancer before, and I think that just made her extra exposed to it no matter what.
Yeah, and then it's the thing about, if it's the hand washing, it's the making sure you're wearing a mask. It's, whether people around you seem like they're symptomatic or not, because too many people walking around asymptomatic, which really makes it a greater risk, especially for the most vulnerable. We know our senior population, our elderly are the most vulnerable, them and the little babies. And so, it comes to a thing to where it seems, in my opinion, it is safer to keep them at home with you. So for those of y'all tuning in to the chat room right now, listening to this chat, and you are up against the fence about what you're going to do, number one, you're not alone. There are a lot of people that's in the same situation as you, and yes, you're trying to figure out what you're going to do or what you can do. But, Kearn, I'm going to switch it a little bit now because, I want to talk about the caregivers, those who are taking care of our seniors. They're sandwiched between the elderly parents, grandparents, their kids, and then a lot of them are still working, having to work, running a business. And so, self-care for that caregiver so that they can still be present for that elderly parent or grandparent. And so what do you think would strike a healthy balance? What do you see as some healthy balances for the caregiver, as far as stress, managing their stress and taking care of themselves?
Yeah, you got to get help. You got to pay for some help. And so I had a caregiver call me not too long ago, and I was listening to what she was saying. Her mom had an episode, and, she didn't, I think she works from home or doesn't, that type of stuff. Maybe her husband works, but either way, she had been at the house because her dad has Alzheimer's. Right? And so so I was listening in, I'm thinking, so you're basically there 24/7, right? And someone had the wisdom to say, we need to pay to get her some help, at least half of the day. A lot of people can't afford to have people in their house 24/7.
Right.
And
Right.
It makes sense. And most people, the guilt all of us caregiver has is, if we put them in a facility or whatever, you feel guilty about that. And so it doesn't matter what people tell you. It's just a thing that you feel. And so a lot of people do keep them at home, but they forget that you have to have time for yourself. It doesn't matter what you're thinking. I can do it. I can handle it. I'm already home anyway. Even if you don't leave the house, get a break so that you get relief and that person getting the care gets relief. Because when you're doing 24/7 or 12 hours or whatever caregiving, you're going to pass that frustration off on your loved one as well.
Right.
And
That's
so
right.
you have to get help. And no, Medicare is not going to pay for it. And I don't even know what's going on with Medicaid right now, but Medicaid has limited funds. That's your state health care. They have limited funds, and you know they ain't got no funds right now thanks to COVID.
That's right. Nope.
Okay, so put your dollars together, and for the brothers and sisters that are not really participating, because I get it, you got a life too. Help out, send some money. I know there are people always say, "Well, I'll come down and give them a break." You know what? Send the money to help pay for some caregiving. And if your parents have a good income coming in for the month on a monthly basis, well, use their money to take care of them. That's what it was meant for. Yes, everybody wants to leave a legacy. And for the seniors that are tuning in, if you need the money to take care of yourself, use the money to take care of yourself. Your children will understand. Yeah.
Right, because they're going to fight over it anyway once you're gone.
You think. And I don't care what people say. Oh, we had a mutual. No, you didn't. There's always somebody. It may even be a cousin, right? Everybody thinks they have a right to somebody else's money. So the bottom line is simple. Use it to keep that person comfortable at home, or if it's in a facility, whatever. But get you some help. If you gonna take up the as they say, take up the cross and bear this effort in taking care of your loved one and keeping them at home, pay for some help. I don't care if it's 4 hours a day. Now let me say this out loud. For those of y'all think that people will get up and crank their car and come to your house for 2 hours, most of the caregivers I have won't do that. And a lot of agencies, they don't want to say that, but that's just the truth. So, plan to do 4 hours. I would try to do a minimum of at least 3 days a week where I get at least some help. And if you can't afford it, get you somebody that comes in and takes over half of the hours that you're doing. And that way you can go sleep, you can go shop, you can go do whatever you want. And so agency, yes, and you'll feel better. You still have there's still some burnout, but you will feel much better. And what I find so frustrating is when the caregiver goes before the person receiving care.
Oh, that makes a whole nother. Now, see, that's about another show. That's a whole nother issue right there. Yeah. My God. Yeah. And so, this is why it's so important to have not just life insurance is good, but not just life insurance, but there's long-term care insurance as well. And long-term care insurance, is not just for nursing home. Depending on the insurance company, it will cover nursing home, assisted living. It may cover home health as well for you to bring somebody in your home to care for that elderly loved one so that you can get a break. And so, Kearn, usually around this time of the show, I usually give the listeners what I call Coach Jean Health Tips for the Week. And one you already alluded to, right? And that was when you said, get some help, because that's one of my health tips for the week, to ask for help. It's okay to say, I'm feeling overwhelmed right now, I need some help, and to seek help. There's no shame in that. The other one is you gotta take time out and have some me time. And what I tell my clients is that even if it means you got to put it on your Google Calendar or your Outlook calendar or whatever means you use to write down your appointments and stuff, that you need to set a couple of hours of me time aside every week. And then, again, seek support. go see your doctor. Go to the local hospital. There are senior centers and senior community. Well, now with COVID, they're out. Well, I ain't gonna talk about that now because of COVID. But online, online groups, and I know that may be challenging for a lot of our elderly population. But if you are a caregiver, go online, go on social media, these platforms, and look up online groups for caregivers and these forums, because they will prove to be a very valuable asset. And so, because the stress of being a caregiver, again, I took care of my mommy. She was with us for 3 years in the late 90s. The stress on the caregiver, oh, my God, you have to have a healthy balance, right? And so, Kearn, what do you have about 1 or 2 tips you'd like to share before we got probably about 5 minutes or so left? We got another tip or 2 you'd like to share.
Well, yeah, as a caregiver, because like I said, I'm a caregiver as well. And so really and truly, I want to, speaking to the caregiver, I know a lot of us get frustrated because there are a lot of things that happen and the parent will not tell you. But that, if you have, this is the great part about having somebody, not your brother and sister. I'm talking about somebody you pay. When you have somebody coming in on outside, now your parent feels like, I'm hiring this person. Now, even if they ain't paying them, they feel like they don't hire the person, right? They will tell them things that are going on with them that they will not tell you. Because parents, what people got to do is understand the mindset of the parent, of the loved one receiving the care. They still see themselves as your parent because they are. So they're
right.
protective of you. And so they will confide in that caregiver. They will tell them if something's hurting. They will tell them if they're worried about something. They'll tell them, my bill didn't get paid. I ain't got, they tell them things that you would think, well, she wouldn't normally tell people that, but they do. So keep that in mind. The other thing is be mindful of, people that come in and that are looking for other things. One thing about caregivers, they're vulnerable, because they're lonely. And right now, I noticed recently there are a lot of robocalls with people asking for your information, talking about they're from the Social Security office, things like that. Your parents are getting those phone calls, okay? They're getting those calls as well. And sometimes they're acting on those phone calls. So you may have to sit down and talk to them and remind them these are not valid conversations. The Social Security people, the government, period, does not call you over the phone asking you for your Social Security number and all that kind of stuff. They do not do that. They do most of their stuff by mail, legitimate mail coming from them. And then so you need to be vigilant on watching that because they are, especially in the time that we're in now, there's a high volume of those calls coming in. The other thing is have the talk about what they need, what their end process is, what would they like to see happen if they were to pass. Go ahead and get your will in state, estate in order, estate planning, that type of stuff. It's not as, a lot of us see that as expensive, and trust me, it's not as expensive as you think. I've had several of my clients that had literally no children, no family, no parents. It was just them. And so we had to assist them in getting a lawyer that was a trusted lawyer to come in and do a will that stated exactly what they wanted to happen, especially when they were leaving stuff to, their friends. I find a lot of my clients leave stuff to their, sometimes they housekeeper that they don't have for 20 years and stuff. Well, if you don't put that in writing, and that's really what you want to happen, or you want them to get a part of that, they're not going to get nothing. Or if you want your children to split things a certain way, you need to write it in the will, but you need to put it on paper, and it needs to be filed with an attorney. And I would say on the average, you could probably get that done from anywhere from $250 to $350. It doesn't really take a lot of time. The lawyer that I had, a good friend of mine that also does elderly estate planning, Kathy Van Sutton here on the coast, she was willing to come out to his house and sit down with one of my clients and helped him, because she said, and I appreciated it because it excluded us from it, right? Because we didn't have to be the person trying to bring him into the office and all this stuff. She went to him. We left the room, and he talked to her, and he told her who he wanted to leave his stuff to. He already knew that he had really close people that he wanted to leave it to, and that was good because it kept us out of the middle.
Right.
So there are attorneys that will do that, and they don't charge you extra if it's in their zone, it's in their zip code or whatever. So do that and keep it simple. You don't have to do all the extra. People think they got to do so many things, and there's a lot. Well, if they're in their 80s and their mind is still right, you might want to go ahead and get that done, because if they don't and their mind starts to go, you're going to have to get a doctor involved and all that kind of stuff.
That's
the other thing is, if you're struggling with your parent who's starting to have memory issues and things like that, then you remember, until they're actually certified, it takes, I think, 2 doctors to say that somebody needs conservatorship. And you have to go to the doctors to get them to do that. Doctors have been flagged on a lot of things now, and so they require you to come into the office. You can't just call them on the phone, right? So you got to come into the office and get that paperwork done, and then take that to the judge. So these are some of the things you may need to do, especially if you have somebody who you think has somebody taking money from them. You may have to declare conservatorship over them. So keep those things in mind.
Yeah, that's a whole other episode. That's right. But look, those of y'all tuning in, we're about to wrap this up, but Kearn made a very good point. You have to have those advanced directives and living wills in place now. And so the bottom line up front, at some point in our lives, we all going to face being in the role of a caregiver, either in the form of self-care, caring for ourselves, or in the role of a caregiver giving care to somebody else. And so with that said, I want to say thank you again, Kearn. I know you are busy, but thank you so much for joining me here in the chat room on this evening. I appreciate you so much. I just want you to know that, because I know you're a very busy woman. And look, to all of you who have tuned in, thank you so much for joining us here tonight for this episode of Health Chat with Coach Jean. A very special thanks to my producer, the Batman of Charm City, Mr. Jerry Royce Live. Appreciate you all. God bless you, Kearn. I will be in touch. Love you all. And good night, my friends.
Thank you for joining us for another episode here in the chat room. Health Chat with Coach Jean, that is. Until next time, if God says the same, I pray peace, health, love, and well-being for you and your family. God bless you.